recognizes Ranking Member Porter.
In our first infant formula hearing, I asked the majority's witness a simple question, and the answer caused a little bit of bipartisan shock. I saw Chairman McLean's head shoot upward, and so I even asked the same question again. So I'm going to start by asking it one more time, this time to you, Dr. Main. Let's say a major formula manufacturer finds bacteria in its supply today. Does the law require it to tell the FDA?
The answer is no.
So we all heard that correctly. The law puts no one at the FDA in charge or on notice if a major formula manufacturer finds bacteria in the supply. So if we want to solve formula safety issues, someone needs to be monitoring real-time bacterial contaminations. Dr. Main, who can change the law to put someone in charge of this? Is it up to the FDA to change this rule, the manufacturers, or Congress?
We need Congress's help to modify that, and we have sought that from Congress.
So I think lawmakers can and must point some fingers at the FDA and at manufacturers, but we need to also be willing to point the finger back at ourselves. The truth is, we didn't do enough in last year's omnibus. Yes, we gave the FDA some new authorities, and one was requiring manufacturers to notify the FDA of any interruption that would likely lead to a meaningful disruption in infant formula supply. But Dr. Main, I'm wondering if you spot the same problem that I do. Let's think like parents here, like moms. If there's deadly bacteria in formula that your infant could eat, would you want the FDA to know about it only when it might cause a supply shortage? Or would you want the FDA to know anytime your infant could get contaminated formula?
Just to be clear, what we really need is in the production, in the manufacturing facility, before it ever leaves that facility. That is what we are seeking, is the industry would notify us before it ever would leave the facility so that we can make sure that the proper amount of formula is destroyed to protect infants.
Yep. So you'd want to know if there was a bacterial contamination, whether it would cause a supply chain shortage or not, the FDA should know.
Correct, and by knowing in real time, that is a good way to prevent a supply chain shortage.
Exactly. So we keep kids safe and we protect supply chain, but we just didn't do enough in last year's omnibus. And look, this was a Democratic-controlled Congress last year. It's on us, I think, to lead the way here. Congress did not provide the authority for a full reporting process, and so now we have more work to do. In the meantime, this has real-world consequences. We've had 2 major infant formula recalls so far in 2023 from Reckitt and Gerber. Would either of these have been reportable to the FDA under the new provision of the law?
No. That was no, sorry.
No. So I'm leading legislation that would establish a process for the FDA to be notified when manufacturers' critical food products test positive for foodborne pathogens. Dr. Main, it's no secret that the FDA has had some struggles in responding to instances of formula contamination. But the FDA has identified this legal change as something that it needs in order to do better. And I'm ready to push Congress to deliver for you and expect you to deliver back to us. So I'm ready to whip Republicans and Democrats to join together to act, but I want to think through the oversight piece of this. Can you tell us a little bit about how required reporting of contamination would better equip the FDA to address contamination issues before they impact? You mentioned identifying the right amount of formula to be destroyed. Are there other features with regard to cleaning or other protocols?
Yeah, so by knowing in real time that there has been product contamination in a manufacturing facility, our experts, our food safety experts, our compliance experts can work with the manufacturers to determine, to essentially bracket or scope the amount of product that needs to be destroyed. And that essentially means any product that was produced since the last sanitation break and before the next sanitation break. And that's where we have seen issues with recent recalls where companies had destroyed product that they identified to be contaminated, but we didn't determine that they destroyed a sufficient amount between those sanitation breaks. So working in real time with the industry to make sure the proper amount of product is destroyed is critical to help support future supply chains and enhance food safety. It also allows industry to do a root cause analysis, working with FDA and our experts to identify why did it get contaminated closer in time to when the actual contamination event occurred.
Thank you very much. I know that members on this subcommittee care a lot about this issue, and I know that Subcommittee Chairwoman McLean does too, and I am excited about the potential to move this legislation forward on a bipartisan basis, and I just want to invite all of our colleagues on the subcommittee and on the Oversight Committee to join in this legislation. We need to give the FDA the information it needs in real time to be able to both prevent supply shortages, but more importantly, to keep everybody safe. Together, we really can help solve this problem. I yield back.
Thank you, Ms. Porter. I now recognize myself.